And I'm so excited. He's a first timer to this show, but he's not a first timer when it comes to the issues that affect so many different community members and families throughout the world. I'm talking about the one and only board certified psychiatrist, Dr. Faisal Tai. Dr. Tai, welcome to Let's Talk America Radio.
Thank you. Thank you for having me.
Excited to have you on. It's important that we talk about the issues that really affect so many people. Tonight, we are going to talk about mental and emotional concerns coming out of COVID-19. And I know so many different people have expressed concerns, so we're going to get there. But before we do, we have a tradition here on World Talk of Let's Talk America Radio that we want to know more about our guests. So in 2 minutes or less, tell us about you. What drives you to address these issues? We know the CV and the resume is impressive. That's why you're with us tonight. But what really motivates and pushes you to really address the issues that you do?
Well, I mean, my job is very fascinating. I'm dealing in a space that's very vague, very sensitive, very intimate. Things that I hear are very personal to people. And it's very satisfying to be able to help these people be able to understand some of the symptoms that are going on, be able to guide them through this journey, being able to connect them to the correct care, to the physicians, to the therapists, to the level of cares they may need. They may need hospitalization, whatnot, but being able to see that reflection on a patient or a patient's family, and then finally understanding that someone understands them, someone can answer that question, is very satisfying. And ultimately being able to do that for hundreds and thousands of patients is what drives me every day.
Yeah, I love it. Thank you so much for your commitment to helping so many different people. Here on Let's Talk America Radio, we often address health topics, physical health, but emotional and mental health, Dr. Tai, matter too. And no one knows that more than a psychiatrist. Thank you for those that are watching. If you're watching the replay, we appreciate it. Tag a family member or friend who needs to have this topic. I'm Shana Thornton, on-air host and executive producer of Let's Talk America Radio, and we're going to dive right into this important conversation about mental and emotional health coming out of COVID-19. Dr. Tai, let's talk about it. We see the reports that they say anxiety is at an all-time high, depression as well, with our adolescents and teens, but also adults, the moms and dads, the grandparents. How did we get here?
Yeah, it's fascinating that you say that, because a report just came out today, and I don't know if you've seen it yet. The number of patients come into the emergency room in the child and adolescent population dealing with anxiety and depression and come into the ED for that reason has spiked 800%. That is insane to me. I mean, the level of illness that is being spread out because of COVID, it's only perpetuated that cycle. And so COVID has not helped it. The lack of socialization, the lack of structure, family breakdown, lack of resources, all of this has combined to create this perfect storm when it comes to mental health illness. And really trying to figure out and solving this problem is going to be key to our success as a community.
So important. I can't help but think when I hear the numbers are at all-time high, is there a possibility, Dr. Tai, that a lot of these conditions were pre-existing prior to COVID, or it's not quite that simple?
Generally, that is the case.
Okay.
But that being said, COVID was sort of a unknown phenomena in our specialty, because we saw patients develop symptoms during COVID and after COVID that they really weren't even prone to, which was sort of bizarre. I mean, I'll tell you, I had a patient that became, psychotic. He was manic, catatonic at one point in time, and really needed some severe treatments and intense treatments for us to get him better. He's doing better now, but really the cases we're seeing, some of them are just so bizarre and just don't make any sense. And a lot of it is, in my opinion, attributed to COVID, which we haven't really figured out, and we haven't seen the long-term effects of that illness yet.
That's true. So true. I can't help, as a journalist, mention misinformation that's been out there. And as a board certified psychiatrist, it's been on so many different levels that we'd be here all night if we talked about it. But is it possible that misinformation could have helped feed some conditions such as anxiety or paranoia, perhaps?
I would not say feed it necessarily, but anxiety, I mean, it's a catch-22 diagnosis, right? I mean, anxiety by definition means you're overtly going beyond what's normal. You're overthinking it, you're overanalyzing it. And so reading more into it is only sort of affecting that illness get worse, right? Which is why getting the right help is very important. Learning to cope well with it is very important. And given that anxiety is so high now that they're recommending even teens and adolescents get evaluated and screened at an early age, I think that's going to be vital in making sure it's not just the evaluation that matters, but also making sure they're getting the right treatment and then
Yeah.
they're engaging in the type of skill set and the coping mechanisms that they need to deal with something like anxiety.
Yeah, I want to talk about some solutions, but before we do, obviously you're a physician, so for you, you know the definition of these. But anxiety, the A word, so many people hear it. You gave a great definition. Can you elaborate a little more, perhaps, of a parent of a teen that may suspect it, but they're like, I don't know what's considered normal for a teen with anxiety or what would be normal? Because to some degree, Dr. Tai, right, I've always heard we have anxiety throughout our lives at some point, but there's a difference if it's healthy or unhealthy. Explain.
That's a very good question. I don't think anyone has ever asked me that on live or radio, TV, or an interview. What's fascinating is so anxiety prevalence of anxiety about 1 in 3 people.
Okay.
So it's a very common illness. Now, any sort of mental health diagnosis is on a spectrum, which means it's not like you either have it or you don't have it,
Mm-hmm.
right? You could have a mild version of it, you could have a moderate version of it, you could have a severe version of it, you could have somewhere in the middle. And stress usually causes it to get worse. Stress, lack of sleep, drugs or alcohol, infection, illness, medical illness, stuff like that can often cause your underlying mental health illness to get worse because it's just stressing the brain out. And so now coming back to the anxiety and what exactly is, so anxiety is fairly genetic. It's something that you're born with. And if you are anxious, which is why the screening comes in effect even at a younger age, what's fascinating is it's a chronic illness. So when you have anxiety, you're going to have anxiety.
See.
As you get older and as you learn to cope with it and as you learn mechanisms to deal with it,
Mm-hmm.
you will have to understand that this is a chronic illness that is episodic in nature. And so you'll get bouts of anxiety, which could last a week, 2 weeks, couple weeks, and then you're fine.
Mm-hmm.
And then you'll get another couple bouts of anxiety for a couple weeks and you'll be fine. And so this repetitive nature of this and the chronic nature of it, oftentimes when we get an anxiety episode or it lasts there for days to weeks, that's when people start getting worried and over analyzing things and getting more worried about things that are unlikely to happen. Not that they can't happen, but they're unlikely to happen. And so this is what we call generalized anxiety disorder. Now, you could have specific anxieties, you could have social anxiety, you could have certain phobias, you can have some of those things, but generalized anxiety disorder is what I'm describing, is that patients will have these bouts of anxiety episodes
Mm-hmm.
and then they'll get better on their own, whether we treat them or not. And usually in these episodes is when people will be more anxious than normal and often end up, sometimes they'll end up either doing negative things, developing maladaptive habits, self-harming, or not being able to effectively function in a society, whether it's work, whether it's relationship, whether it's in your family, whatnot. And so being able to understand yourself, understand the illness, and learning how to cope with it is truly helpful in treating these symptoms.
Yeah, that's so, so key. Thank you for that great description of what it means. You are watching Let's Talk America Radio's video edition of Real Talk. I'm Shana Thornton, on-air host and executive producer. We're talking to the one and only Houston-based board-certified psychiatrist, Dr. Faisal Tai. He is breaking down anxiety. We're also going to talk about depression coming out of COVID-19. Perhaps you know a family member or friend, or maybe yourself, you have dealt with it. This is a real conversation where we are taking the stigma off of mental and emotional concerns and truly addressing it with the right expert here. Dr. Tai, I have to ask this. you talked about what it is, and that for some people it's sort of they cope through it and they have bouts of it. And it sounds like they may have been dealing with it perhaps all of their life. Is that possible?
For a majority of the people, yes, that have anxiety. Now, COVID did cause some patients to develop anxiety that had no symptoms of it prior to that. And so that's sort of like an odd phenomena that happened in our medical world, which really don't have answers for yet, why it happened, how it happened. Sort of it came out of nowhere and it's caused people to have actual issues with,
Yeah.
concerns and illnesses with their brain.
Yeah, I want to talk about the S word of solution right now. And I know as a psychiatrist, obviously you believe that people can get help for anxiety, or like you said, on the spectrum, maybe it's an extreme, severe form of it. But, and also I'm going to throw in depression, which is separate, but we're going to talk about that in
Sure.
about 2 minutes. But what would the solution be for someone watching you right now? They're saying, okay, they know they have the condition of anxiety. Maybe it's general, or maybe it's a specific phobia. How exactly can they get back to the healing conversation now that perhaps we're out of COVID or COVID still lingering? How do they get there to get back to be functional?
That's a good question. The number one thing is going to be acknowledging that there is something that is out of the norm going on.
Okay.
We don't have to. I think a lot of people sometimes get lost with labels and mental health. Certainly it's getting better nowadays, but it's still somewhat of a taboo, depending on
Yeah.
sometimes the culture you're coming from. The number one thing is going to be acknowledging that this is happening, that there is some underlying uneasiness that you're dealing with that may be affecting your life negatively. Once you accept that, I think then the doors for treatment open. Unfortunately, due to the situation in this country and the broken healthcare system that we're part of, it's very difficult to get access. You could want to see a mental health professional, but sometimes you're waiting 6, 8, 10 weeks to get in front of someone. And so I think even when patients do get to the acknowledgement that they do have something, they can't find anyone. And I think that's the other part of the problem is not having access to care when you need it the most. And
Yeah.
by the time they get the access to care, the nature of anxiety is it's sort of dissipated after a few weeks, right? And so then they get in front of the doctor, there's nothing wrong. And then they
Yeah.
get back out in the community and they're a few weeks later they're back anxious, and so this cycle keeps repeating. And so the key is to be able to try to, for physicians even, we want to see it when it's happening, because that gives us a better idea on what's going on. Because if you're doing well, then you have to be a very good communicator for us to truly understand what's going on.
Yeah, and that, like you said, can be the complex part to it. By the time they get in front of a family practitioner to ask for perhaps a referral to a psychiatrist, that this problem seems to be well, and then it's an up and down cycle. How
Correct.
important is it that individuals of any part of life, families, a mother, father, whoever, that they be a part of a network of supportive people? Because you talked about the stigma, and it is getting better, but as a journalist, it's still there. I see that out and about in the community. And one of the things that I think often comes up, and I love the phrase that you use, you said perhaps recognizing and acknowledging that it's not normal, that this is impeding upon your ability to function. Because so many people will have family members of saying, what's wrong with you? And that word, I think, leads to a stigma of saying, well, there must be something wrong, right? And I don't want to acknowledge there's something wrong. So
Right.
there's nothing wrong with me. And that prevents people from seeking the help they deserve.
Truly, and I think one of the things you touched on, the network, which is so huge. And what's fascinating is actually when you look at populations and you would look at ethnicities and you look at culture, we have a lot of great things in this country, but family structure support is not one of them. When we look at Eastern cultures, for instance, you go to Asia, their levels of depression, anxiety are much lower. Even in the US, when you look at certain ethnicities that stick together and have very strong family support systems, their level of depression and anxiety is actually lower. And one of the things that tells us that the support system is vital for us to feel, a human being. And these are not things that are abnormal. And as you said, this is not something where you go to a therapist when you need help necessarily. These are things that we naturally used to get in a community which was very supportive, pre-technology, pre all of this stuff, right? I mean, we would get validated, we would get supported, we would get reassurance. I mean, this was a normal part of your everyday living. Your uncles, your aunts, your cousins, let alone your parents and your siblings, right? I mean, there were big families that would support each other. And unfortunately, in our society today, there's a lot of good things about it. One of the unfortunate downsides is that support system is sort of lost. And so what was happening naturally is not happening. So now you can either build that strong family support system. The other option is to try to go to therapy. So you can try to learn some of these ways to validate yourself, to have that support system, to see what is it that you need and want. Maybe you do need some sort of social life. Maybe you don't. Maybe you need someone to tell you that, you're doing a great job. Maybe you don't, and so these
Yeah.
are things that are helpful to understand. And some of these problems have sort of creeped up because of our basic foundation structure that we were used to for hundreds of years has sort of evaporated in present day society because we're very individualistic.
Yeah, yeah. Such a great point. And society is so transit in so many ways now, right? And so there are many individuals who don't necessarily live next door in the same area as their parents and siblings have moved away to cities such as Atlanta, Houston, LA, New York, and they're the only one of their family members that are there. So perhaps, and this is me going out on a limb, not being an expert like you, but perhaps they're surrounding themselves through coworkers or people they're meeting that maybe don't know them as well as family members who are able to spot maybe there is a difference, maybe the anxiety has worsened or gotten more
Sure.
extreme, or the depression is different than what it was 5 years ago because it's transit. I'm your neighbor, I see you every now and then, and I'm waiting.
Correct. And really, I mean, you hit it on the point. The support system is vital. Be surrounding yourself with people, friends or family that know you well, that have your best interest, that are going to provide you feedback irrespective of your response or reaction to them is very helpful in gaining some insight about what could be happening that you may not always see or understand about yourself. And
Yeah,
perhaps that could be a reason. My suggestion to any viewers is that if someone is mentioning to you that you may have anxiety or depression or any of these symptoms, any sort of mental health symptoms, for, thank them because they're doing something that they're just being a mirror and trying to reflect and provide you some feedback. Maybe they're wrong, but it's worth looking into it and seeing
absolutely.
that maybe is there something that I can do to actually become more functional to improve my quality of life. And I think and it goes back to basic understanding of what mental illness and how mental health works is it's not really a black and white issue. It's not a matter of whether you are depressed or you're not depressed. The matter of a spectrum. You could have very mild symptoms where they don't bother you.
Correct.
You could have symptoms that are a little bit severe, or they may have been worsened because you lost your job, because you lost a
Yeah,
loved one. It could be a lot of different reasons, but you never want to be in a position where you're not willing to engage in that conversation. You want to open yourself up, talk to a professional, allow them to sort of work with you and really try to help you because it will improve your life. It can't hurt, right?
yeah,
And that's the whole
absolutely.
idea is it can't hurt if you get help.
Yeah, absolutely. There's no harm there. You can only perhaps get better. And that's the key to life because it's about quantity, but also quality
Yes.
of life as well. Before you leave us, I want to talk about depression as well, because I know they are separate or depression is separate from anxiety. Define depression and who's prone to depression. Is it equal opportunities for males or females?
So depression is defined as a week to 2 weeks of low mood, low energy, low motivation, uh, sleep issues, appetite issues. And again, depression is very similar to anxiety. In fact, most of the medications for depression and anxiety are very similar. A lot of the treatment is very similar. And the prevalence of depression is 1 in 5 individuals, whereas anxiety is 1 in 3. So anxiety
Okay.
is a little bit more common,
Mhm.
but depression is still almost as common as anxiety. And it's something that again is very episodic and cyclical in nature. And I think
Okay.
that's sort of the dilemma is people will be depressed for weeks and then they'll be fine for months, sometimes years, and then they'll go into another depressive episode. um, Postpartum, moving out, transitioning,
Mhm.
A lot of these situations sometimes can provoke you to be in a depressed state, but oftentimes a lot of it could also be partly genetic, and then some of it is environmental. And learning to cope with some of this stuff better is what prevents you to deteriorate significantly, as opposed to having some depression, but being able to sort of guide, and get past it.
We had a therapist on a few years ago that talked about it. She defined situational depression. And when you said environmental or situations of people moving out, I would imagine you're talking about such as death, grief, that would be something you would expect people to be depressed if they have to bury their mother or father.
True, correct. And that's a good point. Grief, how do we psychiatrists, when should a patient worry about, is this grief or
Yeah.
is this true depression? And
Mhm.
so some of the telling signs that we're looking for professionally when we're assessing patients are sort of red flags for us, right? Is this person not functioning? Are
Okay.
they laying in bed all day and not able to go to work? If you're in grief for a couple of weeks, if you have one or two symptoms, it's one thing. If you have four, five, six symptoms, it's a
Yes.
different thing. Are you having thoughts of not being here? Are you having
Mhm.
thoughts of feeling like no one cares about you and you would rather be not alive? When you start having those kind of thoughts, then that's definitely an indication you should go see someone, because you wouldn't have that in grief.
Yes.
Those are things that we want to look at, is when when you stop enjoying anything in life. Some of those key telling signs is what we're looking at. Something like that happens, you definitely want to try to get professional help.
Yes, absolutely. That's so, so key. As we begin to exit this conversation, you're watching Real Talk, produced by Let's Talk America Radio. I'm Shana Thorne, one of your hosts and executive producer, speaking with the one and only board certified psychiatrist, Dr. Faisal Tai, based out of Houston, Texas. So excited to have him on, very highly regarded in his field. Um, Tell us, as the solution, and you talked about seeing someone getting the help, but what life can look like when people do address anxiety and depression, how it can be on the upswing, and that really life can be one of high quality.
Yes, very much so. There are tons of high functioning people, CEOs, executives, physicians, attorneys, journalists that I personally see that get treatment, and they're high performing individuals, and their quality of life is much better today than it was 5, 10 years ago. And this is something, it's fascinating because you see individual journey, you understand how much of a difference it makes, because it takes a little bit for people to accept the fact that, you know what, they need help.
Okay.
They'll initially accept it, and then once things are better, they'll sort of back off and maybe stop going to therapy, stop taking medications, and they sort of revert back. And then they're like, you know what? If I think and look back at my life was so much better, much more quality. I was much happier. I was less irritable. I wouldn't get angry at everything. I wasn't bitter.
Yeah.
And they start noticing and reflecting on some of that stuff, and then they go back to treatment and they continue with treatment for the rest of their lives. And then it's not sort of a burden that I'm getting help for the rest of my life. It's sort of coaching. It's
Yeah.
sort of like understanding, like, hey, this is healthy. It's like working out. It's not like you work out for 6 weeks and once you're getting back in shape, you're like, you know what, I can stop working out now. You continue to work out because it's a healthy
That's
way of living. And so the same thing with mental health care, right? You have to care about yourself. Seeking professional help doesn't mean that there's something broken inside you.
correct.
It's a healthier way of living. It's a better way of living, more engaging, um, you know, better quality of life ultimately.
Mhm. I love it. It's all about progress. Dr. Time, what a pleasure to have on the show. I've got to ask this question. There are viewers that are watching us that saying, okay, I hear him. Maybe they have some anxiety. Maybe they have some depression. They're saying it's time to get it addressed. They're going into 2023. They're ready to claim their life back. But so many other physicians, such as practitioners or internists or cardiologists, can vouch for this. When it comes to taking out the prescription pad, lots of patients cringe. Okay, you know that. They're not always compliant, or they don't want to be reminded of yet they're on one other pill on
Mm-hmm.
top of the antihypertensive, the medication for dyslipidemia, and so on. So talk about how, I mean, it may be, obviously you're a board certified psychiatrist, so there may be times where people may need to be on medication, but does it mean every time that someone sees a psychiatrist or a psychologist or a family therapist that they're automatically going to be placed on medication?
Correct. No, it doesn't mean that at all. And even if you do get prescribed medication, it doesn't mean you have to take it for the rest of your life. Ultimately, for majority of the people, it's a quality of life matter. If you're
Right.
taking meds and you're feeling better, then really it comes down to you.
That's
As
right.
long as you're not in a position where you're self-harming, you're hurting yourself, hurting anyone else, or you're manic or psychotic or something like that. For most patients, it's a quality of life issue. And so it's a conversation to have had with your professional help, whether it's a psychologist, whether it's a psychiatrist. Sometimes you may need medication, sometimes you may not. Sometimes you need to go to additional classes for cognitive behavior therapy or some
Yes.
other form of therapy. And so, really, it's something, it's a conversation that has to be had. And if you need medication, hey, ultimately, it has to be a discussion between you and your psychiatrist in understanding the nature of the medication, what it's doing for you, its long-term side effects, and the effects if you don't take the medication as well. And I think we have to put
Good
both of
point.
them in perspective
Yes.
when we're choosing to decide whether we're going to go down this route or go down this route.
Absolutely. Yeah, so key. Often cardiologists or neurologists will come on the program and they'll say, you have to weigh it out. And yes, many people don't want to think of themselves as being sick or needing medication. But if being on that cholesterol drug or that antihypertensive drug prevents a stroke or a heart attack, then we really have to think about what matters. And
Right.
like you said, if someone's in a situation where their thoughts of harming themselves or others, they really need to seriously weigh what's best.
Correct.
Yeah,
Correct.
such a great conversation. Dr. Tai, what an honor and a pleasure to have you on Let's Talk America Radio. We're gonna have to have you back on, but what a moving conversation that I'm sure really is going to impact in a positive way so many of our viewers. Before you head out, tell our viewers where they can go to find out more information about you and your platform.
Yes, so they can certainly look us up at psychplus.com. That's psychplus.com. We're in the forefront of trying to help the mental health crisis in this
Yes,
country, increase access to care, and provide resources to patients, to people just looking for some guidance, help. And just because they're coming to us doesn't mean we're going to put them on a medication. There's a lot that happens in this space. A lot of it comes down to education and engaging the patient and
absolutely.
them understanding themselves. For us, that's key.
Yeah, education is so key because, as the old adage says, when you know better, you're supposed to do better. And that means addressing every aspect of your health, physical, emotional, and mental. Dr. Ty, thanks for being on Let's Talk America
Thank you,
Radio.
Shana.
Where viewers, you heard from yourself firsthand, an individual who's an expert, and there can be hope in terms of emotional and mental health. So do not give up. And of course, you heard the information where to reach out to him. If you have any thoughts of harming yourself, we're going to put in our comment section a phone number you can call, a suicide prevention line. So get the help you deserve. It's so important. Okay. You don't have to go through it alone. Thanks for watching Let's Talk America Radio, an award-winning national platform that continues to address the important issues and concerns of our world today. Okay. We're here with you. Connect with us at ltaradio.com. That's ltaradio.com, or follow our hashtag on your favorite social media outlet. The hashtag is LTA Radio. That's LTA Radio. Take care, everyone. Have a great holiday season and a phenomenal 2023. And we'll be back on with you soon, Dr. Ty. Thank
Thank
you.
you, Shana. Thank you.
Bye, everyone.
Bye.